everyone, I'm Sumaya Ahmed Junior, first year student of Abdul Medical College, Noakhali. Today we discuss about the ovary. After watching the video, we can learn about what is ovary, situation, shape and size, position, external features, presenting parts and their relation, arterial supply, venous drainage, lymphatic drainage, and nerve supply. Let's start. What is ovary? The ovaries are a pair of female reproductive glands. Situation. Here, the green marked area indicates the lesser pelvis. Each ovary are situated in the lesser pelvis, one on each side of the uterus and attached to the posterior layer of the broad ligament, below and behind the corresponding uterine tube. Shape and size. Each ovary is almond in shape and presenting the following measurements: vertical 3 cm, anterior-posterior 1.5 cm, transverse 1 cm. Position. The position of the ovary is variable. In nulliparous adult, it lies in the ovarian fossa below the pelvic brim. In the newborn, ovary is situated above the pelvic brim. Here, the red circle marked area indicates the pelvic brim. On very rare occasion, ectopic ovary may be found in the inguinal canal or labium majus due to error of dissection. Labium majus is the singular form of labia majora. After repeated pregnancies, it may be prolapsed in the rectouterine pouch. External features. The ovary is an intraperitoneal organ. In young girls, before the onset of ovulation, the ovaries have smooth surfaces which are grayish-pink in color. After puberty, the surface becomes irregular and color changes from pink to gray. In nulliparous women, its long axis is nearly vertical, so that the ovary is usually described as having an upper pole and a lower pole. However, in multiparous women, the long axis becomes horizontal, so that the upper pole points laterally and lower pole medially. Presenting parts. Each ovary presents two ends: tubal end or upper pole, uterine end or lower pole. Two borders: mesovarian or anterior border, free or posterior border. Two surfaces: medial surface and lateral surface. Relation. Tubal end. Tubal end is directed upwards and present the following relations: uterine tube, which arches over it. Attachment of the ovarian fimbrium. Suspensory ligament of the ovary connects the uterine tube and the ovary to the pelvic brim. Uterine end. Uterine end is directed below and connected to the lateral angle of the uterus by the ligament of ovary. Mesovarian or anterior border. It is attached to the posterior layer of the broad ligament by a fold which acts as the hilum of the ovary and conveys ovarian vessels and nerves. A white line known as the line of ovary is observed along this border due to a transition between the flattened mesothelium of the broad ligament and germinal epithelium of the ovary. Free border. Free border is convex and related to the uterine tube in the upper part. Further behind, it is related to the ureter and internal iliac vessels beneath the peritoneum. Medial surface. Medial surface of the ovary is related to the terminal part of the uterine tube separated by the bursa ovarica, which is a recess between the mesosulfinux and the ovary. Lateral surface. Lateral surface is convex and rests on a peritoneal depression of the lateral pelvic wall known as the ovarian fossa, which presents the following boundaries: above and in front obliterated iliac vein, above external iliac vein, behind ureter and internal iliac vessels, lateral wall or floor formed by the parietal peritoneum and obturator nerve and vessels pass beneath the peritoneum. Blood supply of ovaries. Arterial supply. Ovary is mainly supplied by the ovarian artery, which is a branch of abdominal aorta. The artery reaches the organ after passing successively through the suspensory ligament of ovary, mesosulfinux and mesovarium of the broad ligament. It is partly supplied by a branch from the uterine artery. Venous drainage. The veins form a pumpiniform plexus which joins further to form a single vein drains into inferior vena cava at an acute angle. The left vein drains into left renal vein almost at a right angle. Lymphatic drainage. Lymphatics drain into pre-aortic and lateral aortic lymph nodes following ovarian blood vessels. Nerve supply. Ovaries are predominantly supplied by the sympathetic nerves. The preganglionic fibers are derived from T10 and T11 segments of the spinal cord. Thank you so much for your time and attention today.